call this meeting to order just a minute or two after 10 o'clock. Let's all stand for the Pledge of Allegiance and invocation, please. Pledge of allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Let's pray. Gracious and loving God, we just thank you for this day. Lord, we thank you for the opportunities we have. We thank you, Lord, for the blessings that we enjoy in this county. Lord, we lift up those that are subject to this virus. Lord, we just pray for our nation. We pray for our world that we will find solutions. And more than anything else, Lord, that we will keep our trust and hope in you. Guide us in the decisions we make, the directions we take. In Christ's sake, amen.
Amen. Before we get into the approval of the agenda, we got some add-ons here on the general business. CBS COVID-19 testing waiver, Alleghany motions, suspension of airport and non-medical travel, and on the presentations we have App Health coronavirus update. Do I hear a motion?
Mr. Chairman, I would like to remove from the agenda under section E for Echo, Roman numeral 2, workforce development reappointment.
Okay. Hear a motion to remove? Second. Second. Motion second. All in favor say aye.
Aye.
Motion to accept the agenda.
So move.
Motion second.
Aye. Second.
I make that motion subject to the removal of previous.
A motion and second. All in favor raise your right hand. Two. A motion on the minutes for the 3-2 meeting, the 3-3 meeting, and the 3-6. Have everybody looked over that? Do they have any?
Hearing no changes, I make a motion to accept.
I second, sir.
Motion and second. Any discussion? All in favor raise your right hand. Public comment. Any citizens encouraged to talk at this time about the items on the agenda? If you feel free to come forward. Being none, we'll move on down to presentation to the board. Lisa Bottomley, Chamber Director.
Morning.
Morning, Lisa.
Morning.
I know that usually you have a spotlight business that comes and presents to you during these meetings, but I wanted to take this morning to actually come in person and introduce myself. I am Lisa Bottomley. I'm the new Executive Director for the Chamber of Commerce of Alleghany County. Just to give you a little bit of background, I am an Alleghany native. I grew up in Ennis, North Carolina, went to Glade Creek Elementary, went to Alleghany High School and graduated from there. Moved away for quite some time, but now I've been back for about 20 plus years. Have not been able to work in the county as I had hoped in the past, but when this opportunity came up, it seemed like a perfect fit for me to be able to come back home and help take care of my community, help build businesses here, the economy, and so. After, I guess I've been there now, Ricky, 3 weeks, Kara? 3 weeks, yeah. So we've been very busy, just looking at things, how the Chamber has been operating, what we can do in the community, how we can move forward. And I just want you to know that, me and my staff and Ricky and John Kilmartin and the board, we really are committed to building trust within our community, with our community members, with our businesses. We want to be supportive of growth initiatives that not only will bring people into this community and support our local businesses, but will also build our infrastructure. So we are very committed to that. We are also, we're already brainstorming about ways to build that trust within our community. Everything from just a simple community cup initiative where we'd invite people in for a cup of coffee with the chamber, all the way to meetings, community service. So I do want you to know that we are dedicated to doing that for Alleghany County. Just to update you a little bit on things that we have going on, since in the 3 weeks that I've been here, I have been working on a more streamlined process, policies, procedures within the chamber. We're even working on an employee manual, help our employees move forward with knowing their benefits, their PTO, things of that nature. Working on the structure of our board meetings and how we interact with our community. We've also been financially been assessing our ads, where do we have a presence, what printed materials are we in, and is that having a good return on our investment? We are finalizing the 2020 magazine, Alleghany County Magazine. We are going to print 10,000 copies, and that will go out to various visitor centers and North Carolina welcome centers, and also across borders into other states and other counties. We have placed the 2020 Cycle North Carolina video that is now on the Authentically Alleghany page and the Chamber of Commerce page. We also have created Kate Irwin, in collaboration with the Chamber, has also created a Alleghany video that will be going on the site very soon. Some things that we've had to kind of take a detour on. We, of course, were going to be involved at Merle Fest this year, and as most of you know, that event has been canceled, unfortunately, for everyone. We had some open houses and some ribbon cuttings coming up. We had one with Greenfield Acres that has been postponed. The Chamber actually had an open house on March 26th that will likely be postponed. And but in the midst of all of the coronavirus and recommendations from the CDC and from our Alleghany Health Department, we are taking on the initiative offering updates for businesses on Facebook. If they have a change in their business hours or a change in the way they do business, and this is for all businesses during the next 2 weeks. It's not just for Chamber members. It'll be for anyone who needs our assistance in getting the word out, keeping our community informed. So I wanted to present this to you. Each of you have one of these in front of you. This is our new rack card. This went out last week. We will keep those, of course, within our chamber, but we also take those to other visitor centers as well. And this is just kind of a snapshot of Alleghany County, and on the back you'll see that it's just a snapshot of upcoming events for 2020. All right, any questions? Me?
Questions? Thank you.
Right, no, thank you very much.
We're glad to have you on board.
Thank you, I'm glad to be here.
Thank you. Next is Karen Evans, Finance Officer.
So good morning, everyone.
Good morning.
I have a few things to present today. The first one is going to be a financial update. Mr. Carter and myself have had numerous conversations about the best way to keep the board informed of just the financial state of the county. And that is where once a month you all are getting this 50-some page detailed report. But also we thought that once a month I would come and show our municipal dashboard that I know y'all have seen in the past. But as you can look, this is our revenue chart, and it shows, what it'll show is today's date. This is real time. Anytime something is posted in our software, it is automatically updated to this municipal dashboard. And what it will show is of today's date a year ago, and then as of today. So as you can see right there, looking at the numbers, we are actually doing really well on our revenues so far this year, because you can see there we actually have a little over $1.7 million more in revenues today than we did this time last year. That's really good news. And on this dashboard also, you can see on the pie chart, you can see the different categories of revenues. So you can see the bulk of our revenues is ad valorem taxes. And then you can still see the sales tax is a good portion. And just to include everybody in down on the bar graph on the bottom, the reason there's such a large jump in September of 2017-18, that's when we changed software. So that was when all the data was pulled in. So then also that's for the revenue side. And then on the expense side, here's our expenses. And if you can scroll down just a little bit right there, okay. So it does the same thing with the pie chart and the bar graph. And then there, right there, you can see the year-to-date expenses as of a year ago today versus today. And we're around $370,000 difference on the expenses. So all things being equal, if this was year-end today, we would build our fund balance some.
What's our fund balance today?
I haven't ran the numbers because of the state stabilization. I don't know those numbers until actual year end. But just knowing that our revenues are $1.7 million more than what they are this time last year, I'm safe to say state stabilization was only like $900,000 this past year. So that's why we would build our fund balance if today was June 30. That being said, and since I'm going to start presenting this on a monthly basis, you all still wish to receive this detailed report? I still have it. You know, I keep it in my office, and but I will be here at the mid-month meeting every month to have this conversation right here.
I just didn't see it this way myself.
Same here.
Too.
This is good.
That's very informative right there.
Okay?
If we've got any questions, we can
Yes.
get a copy.
Oh, yes, because I have a copy in my office. And the link to this dashboard is on our website. It's on the homepage on our website, and it's also on the finance office webpage as well. That was the first thing I wanted to talk about. The second thing, we have received really good news from our insurance company, Blue Cross Blue Shield, on our rates for this coming year. They have quoted us at level rates, which is wonderful because that's not been our track history. And in that, with them giving us level rates, they have also come back to us to reduce our deductible on our base plan by $250 per employee, per individual. So I just wanted to kind of give the board that update and talk about that. It was, great news that first our rate stayed the same, and then we're doing so well that they actually even reduced our deductible by $250. So that should help employees who reach their deductible. That should help them a little bit financially there. The last thing that's on the agenda, but I do have a couple other things I would like to mention. The last thing on the agenda is talking about communities and schools, and we have the Juvenile Crime Prevention Council has monies that flow through us that requires a 20% match. And Communities and Schools is one of the programs that the Juvenile Crime Prevention Council had awarded monies to go towards for this budget year. On March the 12th, 2020, I had received an email from the North Carolina Department of Public Safety, Division of Adult Correction and Juvenile Justice, stating that we need to hold the disbursement for communities and schools until we have further notification from them. So I'm letting you all know those grant revenues then are sitting in our account, and we're not providing them to communities and school based on the information that I have received from the state asking us to hold off until we hear further from them. It was just a FYI to the board.
So that means the money that we had allocated to them is now on hold, correct? Is that separate funds?
This is separate funds. This is the JCPC funds. This is grant funds that we receive from the state. The county's allocation is something totally separate.
We've given them extra funds.
The JCPC board had allocated this back like this time last year.
We're talking 2018, 2019 budget.
No. The grant is for a year at a time. So the year that started July 1, 2019 is the grant monies that I'm referring to right here.
Did they give us a reason?
The only thing that my email says, in light of the recent terminations and the financial concerns, that's the only thing. I mean, my email is literally like 2 sentences. I was just going to let the board know because that is monies that we will be holding of the states. and it will have to be paid back at some point.
What is the status on the money that we allocated to them previously? I'm not talking about under the grant. We gave them funds, I believe $20,000 that we attempted to rescind.
Correct, and the status on that is we have converted the payments into monthly payments, as we've done with all of our entities like that. And so we have paid them up and through March. We have not made a March payment yet, just because of those payments don't get paid until the next check run.
I look at the council, and if we make a motion to suspend payments until further information is provided, you're going to tell me it's not on the agenda and we can't do it, aren't you, madam? Mr. Chairman, I recommend that we place this on the agenda for further consideration at the April meeting.
Motion?
Question. It's on the agenda now because of what Karen is presenting to us.
Only as a presentation to the board requiring no action.
We're asking for action.
It doesn't say for action, it doesn't say not for action, it
It
says
says presentation to
presentation.
the board.
So you suggest we wait till April?
I suggest you wait until you get more information. Could be there are no children in school because we know there won't be for the next 2 weeks anyway. I don't know how they would be operating. I don't know enough about if there is a way for them to operate at all with there's no children.
Mr. Chairman, I'd still say that we put it down on the list for the agenda for consideration.
I would second that.
Still don't know the problem with the school situation. I mean, we don't know if if the school's not operating, they're not operating. Correct?
Correct.
We get a
Because
cop,
actually, the after-school program was, my understanding, it was halted before school was canceled.
But no one has asked you to quit sending the money. Now your direction are that you will send a monthly check. Am I not correct?
That is correct.
Until the board
Until-
takes action that says that you are not to send that check,
Correct.
you will continue sending that check.
Correct.
We can take this 30 days at a time and put it on the table for a month from now, and if school's in or out, we'll have a better idea which way we need to go.
I would like more information on why they've suspended also, sir.
we get a copy of that email.
Sure.
Get a motion to do that?
No,
motion,
we're
no
simply
second, right?
requesting
So
information.
we just take consensus here.
For an agenda item for next meeting.
Okay. We'll take care of that.
I have a couple other quick things that's not on the agenda, but I just wanted to mention it while I was here. I was in Raleigh week before last, and I actually saw Sharon Edmondson with the Local Government Commission. If y'all recall, she's the lady who wrote our letter in December. And so I had a quick conversation with her, and her comments to me sounds like that we are on track and doing everything that we needed to do, and that she didn't foresee any additional issues that we need to be aware of at this time. So I just thought I would relay that good news to the board, that I actually had a conversation with her in person. It was a week ago, about 2 weeks ago now. The only other thing that I wanted to mention is late last week, I actually received a FedEx package that we had to sign for, and it was where we have actually paid off the loan on this building. So I thought I would like to let you all know that. So we actually own this building outright now, so that was good news, I thought.
Yes, it is.
We have a party and burn it, and
Sure, yeah, that'll work.
I don't know, we may be looking to refinance it with these low rates.
Thank you all for your time.
Thank you, Karen. Appreciate what you do. Next is Mr. Jonathan Hartzog, RC&D program.
Morning.
Morning.
I'm glad to follow on that good news.
Yeah.
So I'm Jonathan Hartzell, not Jonathan Hartzog, just to clarify. I've been called Fartzell before, but so yeah, I'm just providing an update on our organization. I'm the director of the Blue Ridge RC&D. Next slide. And the Blue Ridge RC&D, or Resource Conservation and Development, we're a nonprofit. We cover a 7-county region, Yancey to Wilkes. And our mission is very long and outdated, and we're working on improving that. But it's basically to improve the human and natural resources of that area. And oftentimes we go beyond that area, partnering beyond that area. So next slide. And here are just some examples of the types of projects and educational programs we get involved with. Water resources, forestry, agriculture, energy, recreation, tourism. Next slide. Water resources. Next slide. Here's one in Alleghany County that we were partner on with Soil and Water and the town and the county. Here's a stormwater bioretention cell up between the high school and community college that was completed. And we're currently working on an educational sign to put out there so people can, the students that go by can learn about what's going on, and people can take field trips there also. Next slide. Here's in Ashe County on the New River Park that we did some stream restoration on. Next slide. Here's this is Mayland Community College, Mitchell County. We did a big stormwater project that captures all the runoff from the roofs and parking lots. Next slide. And here you can see what this looks like. This is the big retention area where all the water from the parking lot will flow into and get treated and slowly released back to the river, so it improves the water quality. Next slide. Wards Mill Dam in Watauga County, we're currently working on that, taking down that dam to restore the river to its natural function because it's no longer being used for power. Next slide. Forestry. Next slide. So we're involved with this Appalachian RC&D coalition. That includes the other RC&Ds from Virginia, and our goal here is to provide outreach to communities on how to reduce their wildfire risk. Next slide. But did you all know that we're actually #1 in the nation for acres in the wildland-urban interface? So that basically means where humans build in the forest. Next slide. And so that's really important because you can see all the money that's spent into fighting fires, all the homes that are lost or at risk, and lives that are lost. So what can homeowners do? We help teach them what they can do. Next slide. Here's just wanted to give this plug. Wildfire Community Preparedness Day is coming up May 2nd. And I was supposed to be at Rich Mountain Acres in Alleghany, but I just got an email this morning that they canceled due to the virus. Next slide. We work with communities, do presentations, teach them about home hardening, fire safe landscaping, all sorts of stuff. So we've reached out to Old Bow, Roaring Gap, High Meadows, Rich Mountain Acres, work with the North Carolina Forest Service, Brandon Keener, Russell Shote. Slide. Extension. We help with prescribed fires. Next slide. Next slide. We're working on a home assessment video with the North Carolina Forest Service that shows homeowners what to do. Next slide. And last fall, we held a prescribed fire education day at Stone Mountain State Park, which was very successful, with a number of different partners, as you can see, fire departments, parks, Forest Service, Wildlife Commission. Next slide. Agriculture, renewable energy. Next slide. So we have this energy cost share assistance program that helps businesses and farms with grants for these kind of energy efficiency renewable projects. Here's a landscaping company, a gym that our partnership helped fund these solar panels. Next slide. And for farmers, we have these specific grants, 25 to 40% cost share. Slide. And then recreation and tourism. Next slide. Here's we've worked on the Over Mountain Victory Trail. I'm sure y'all have heard of that. This one actually worked in conjunction with the project. Next slide. The Middle Fork Greenway, Boone to Blowing Rock, we're involved with that. Next slide. The Sparta Veterans Park, as you all know, it's taken some damage from the flooding, so we're looking to repair those stream banks. But we've also in the past worked with the Alleghany Sparta Trails Association, system, Alleghany County. Slide. And that's just an overview of kind of stuff we do, and please let us know if we can help you out. And we also have a watershed coordinator that comes up, and I forgot to put it in the slide, that comes up and works with the schools and the soil and water districts, does outreach programs with landowners here quite a bit. Also, she lives in Boone.
The waterway there in that Veterans Park, there's a couple of large trees across that water now. Who's responsible?
Who owns the land? On both sides?
County owns where the trees is falling around, yes, county.
As responsibility with implications for safety or for
Both.
both? I guess it would be the county. There are some new grants that help remove woody debris from flooding and stuff. Look into if it's a big enough problem.
I don't know if you visited our fairgrounds or anything,
Not lately, I haven't.
but stream bank, the stream that runs through there, there's numerous places that it's eaten the bank away. All sorts of stuff is falling into the creek, old trees, there's tires in there, there's just a lot of erosion. Is that a project that you could look at, or?
Sure, definitely. And I would also like to thank, Bill actually serves on our board, and he's notified me about that, and just need to look into it more.
What do we need to do to get the ball rolling to?
Need to look at it, and then we would probably need to get an engineer, someone to go out there and tell us what they thought would need to be done to get it fixed, and then go after grant funding to, unless you had money just lying around that you. Okay.
It is something that we don't need to pass a resolution or anything like that. It's something that you can just come and look at, or?
Yeah, as long as you all are comfortable and all agree that that needs to be done.
Do you need a consensus from the board, or what's the first step?
I guess just me going out there, and then if we were to apply for grant funding, we would need a letter of support, most likely, from the board saying.
What are you doing after the meeting today?
I don't have to be into West Jefferson till 1, so I'm here.
On the Veterans Park, you are pursuing some grants, I guess.
Yeah, but I think we're looking into the other landowners, if they'd be agreeable to, some of the funding requires
We got a
easements.
challenge there.
Yeah, we got a challenge there.
Work through that, but maybe that'll come together. Are working on it though.
That's right, yep. Yeah, I'll go check that out today.
Just any time that we can get together and get started is the main thing.
Other questions? We appreciate you coming down and making a presentation today, because it enlightened what RC&D does.
Thank you.
A lot of good projects there.
Appreciate it.
Thank you. Next, Mr. Ricky Brown, Alleghany Health Update.
Good morning. Hope everybody's well. It's my pleasure this morning to introduce my partner here, Catherine Doby. She's the Chief Operating Officer at the hospital. She started March the 1st. She's been with Wake Forest and affiliates of Wake Forest for over 25 years. Her latest duties for the last number of years, she's the Chief Administrator of one of their largest practices in Winston-Salem, their ophthalmology division, and we're very pleased to have her in Alleghany County. She's moved here, a resident now of Alleghany County, and working at our hospital. And she'll be available for anything you might want to ask about the virus from the hospital's perspective later. But my purpose today is to give you an update on where we are in the hospital project. It's obviously all of us have been somewhat frustrated by the slowness of getting this project started. I share that with you. But before I talk about where we are, I'd just like to thank you for what you all have done. Your support over the years prior to this project, and your support and lead gift in our pledge program to save our hospital and to get the partnership with Wake Forest and Hugh Chatham started to keep running our hospital was absolutely essential. So thank you all very, very much for what you did and your continued support. That support is leading us to where we are today. It is really good news. It's taken longer than we've wanted, but I must tell you that our partners have done what they have said. They have been in the hospital, they've updated the IT, their plans on how this new rural medical facility will look has been done. They've gotten everything approved with CMS, the Medicare, Medicaid people, and they have supported our hospital financially. So as I said, we are frustrated, but I want to tell you that if we had not done what we did, if we didn't have our new partners, we would not have a hospital today. We would be talking about how to get a hospital, and you know that would be almost impossible. So we are very fortunate that we have the hospital that we have and the new developments that will make it really a leader in rural health as we go forward. So where are we today? So the good news is that the entities, Wake and Hugh Chatham, are moving forward. We have a new contractor that has been put into place, Frank L. Bloom out of Winston-Salem. They've done a lot of work for Winston-Salem's Wake Forest outfit over the years. They are in the very final stages of signing the contract. That should be done very soon. The expectation is that construction would begin the first week or so of April, and the outstanding project will be delivered hopefully in the fall of 2021. The site manager who's working for Bloom is already up here doing all the sort of introductions and beginning to line out what's getting ready to get done. So that demolition and construction aspect will start that first week of April. Hopefully we'll have good weather through the spring and they can get a really good start on that. So we're really excited about where we are in the project today. What will be delivered is approximately 20,000 square feet on the main floor. You'll have family medicine and all of the specialty clinics there with access into the hospital for labs, x-rays, etc. The ER will be updated. The operating rooms will be updated. The second floor of the facility will allow for the physical therapy, pulmonary therapy, etc., along with some space for additional expansion over the years as things grow, as we hope our county grows. So the facility will deliver on all the aspects that we had said early on when we were raising the money. We're very pleased about that. And so we are getting ready to get started. We should see a press release very shortly. We should see a planned event. The virus has stopped that for now, but a planned event to show all the drawings, et cetera. We'll do that as soon as we can. That will not stand in the way of getting started, but hopefully we can continue to give you updates on where we are. You'll be able to go with a groundbreaking soon, and we're going to be able to see really good progress here very shortly on our medical office building. Already, we've been operating the hospital with the final 6 beds that the facility will have, 4 observation, 2 critical. That's been doing the last several months. We've been operating that way. And so the good news is that our hospital is intact. The good news is that it will be a central focus of our economic development going forward. And we appreciate, again, all that you all have done to get us to this point. This community really stepped up. When you think about a community like ours, raising $6.7 million to save our hospital shows you how important this facility is to our citizens, to their health, and ultimately to the economic development of our county as all of us improve, hopefully, the prosperity of our county. So again, I'll end by just saying thank you all for your support, thank you all for your patience, and thank you all for being there for the hospital when we needed you. And it's going to be a tremendous investment that pays off handsomely into the future. We thank you all very much. I'll be glad to take any questions, and if I can't answer them, maybe Catherine can.
Just, thank you. How many beds do you have now?
6.
How many beds when you finish?
6.
So it's going to stay at 6?
That's right. If you remember, Bobby, there were 25 originally. We were only averaging about 4 a night, and the new facility will have 6, 4 observation and 2 sort of critical beds.
What patients would use those 6 beds?
You'd have people that would potentially come into the family practice that's ill, people coming into the ED that need to be observed to determine do they need to stay, go somewhere else for different kind of care, or could they just go home after that observation? And a couple of those beds are more critical where you'd be for longer term stays.
For 6 beds, I'd always wondered how that number 6 came about. That's based on your past.
Based on the past
occupancy
history,
average,
that
I
is
guess.
correct.
Right.
Yes, sir.
Okay.
Yes, sir.
I get a lot of questions about the 6
Yep.
bed deal.
That's right. That's right. That was the average for several years
Right.
going into this plan. Remember, the good news is with the partnership with Elkin, you know, we're right down the mountain, so if you need that longer term kind of care, we can go right down the mountain.
The question.
Since your fundraising has been so successful, I take it you no longer need the county's contribution?
No, John, we do need the county's contribution. Thank you, sir.
Don't
No, we need it.
don't brag on your success so much. Thank you.
We need you. Your leadership early on was very important. Thank you.
Other questions, anybody?
Thank you.
Thank you, appreciate it.
Welcome aboard, ma'am. Welcome to God's country.
Thank you, thank you.
Moving into general business. Okay, Appalachian Health, I'm sorry.
Andy?
I'm sorry, I apologize. Jumping the gun, yeah.
Morning.
Morning.
My name is Andy Blethyn, and I'm the Environmental Health Supervisor for the Appalachian District Health Department. We are currently dividing up duties, as normally you would see our Health Director, Jennifer Green, but she is in Ashe County updating their board of the coronavirus situation that we're currently experiencing. I've given you a couple of handouts, and at the first, the most recent numbers, now this was as of yesterday. The DHHS site updates every morning around 11 o'clock. So these numbers are probably going to go up. But as of yesterday, North Carolina had 32 confirmed cases of coronavirus, 0 deaths. Nationally, we are looking at 1,694 cases and approximately 41 deaths. But I'm sure when the state updates its website this morning in just a little bit, those numbers will probably change. So where are we now? Yesterday, Watauga County received its first presumptive positive. Now, what this means is that a healthcare provider, either the local health department or a private healthcare provider, administered a test, sent it off, and it came back positive. The protocol is that the CDC, Centers for Disease Control, has to take those results and confirm it. Once they confirm it, then we have a confirmed case. We expect to get that back in the next day or so at a minimum. What Watauga County did yesterday was thus declare a state of emergency, primarily to start opening the doors for federal and state assistance. to get resources in through emergency management, financial aid and help for the community and for the organizations that are actively trying to prevent the spread. This morning in Watauga County, the health department has started testing. We have a drive-through clinic, and those people that meet the criteria, they have a fever, a cough, and respiratory illness, we're starting to see those, taking some samples and sending them off to the state lab in Raleigh for testing. In addition, the health department has instituted its incident command structure, its ICS structure. And this is basically a management control system that breaks our response down into different components such as command, control, logistics, operations, and finance. It's kind of a divide and conquer. We set up all these different areas so that no component is missed. And our staff have been setting up into that, and we are now actively in that system as part of our response. So the three main areas that we are currently looking at now are triage, surveillance, and isolation and quarantine. Triage is basically trying to figure out who is sick and who is not. We have a lot of the walking well that are calling in out of concern. Maybe they've got a slight sore throat, or they've got a fever. Maybe they just have developed seasonal allergies like I have. They're not sure. And so they're calling their healthcare providers and the health department, hey, I'm feeling this, do I need to come get tested? And so we are trying to triage those. If they have a medical need, a medical emergency, then of course 911 is called. If a physician or a nurse feels that they meet the criteria, then they would be instructed to come in either to the health department or their local provider to receive a test. Our number one goal right now in triage is to keep the emergency departments from being overrun with people that do not need to be there. As you heard, the hospital here has 6 beds. Those are going to be at a premium with people that need ventilators and ICU care. So our goal, working with local providers, is to keep as many people from showing up at the hospital and taking those limited resources. And we will continue to do that. Surveillance, once somebody comes in and we feel that they need to be tested, then they are administered the test and they are asked to self-isolate, meaning, Erwin, if you came in and we administered the coronavirus test to you, your doctor, nurse would ask you to just go home and keep yourself in front of the TV while we're waiting for the test results. If you meet those criteria that require you to be tested, then we have to assume that you may have it, and we don't want you to be out in the community further spreading it around. So just because somebody has been asked to self-isolate does not mean they have it. It's preventative measure to try to stop potential spread. As I said earlier, a presumptive positive, if that test comes back, and let's say it says that you have the COVID-19, then that will be sent to the CDC for confirmation. So it's double confirmation. We're not going to go by one test. Not all tests are accurate. Sometimes you get bad testing kits. So we want to make sure before we take it to the next level that you actually have this disease and then need to be quarantined. In addition, we also start what's called contact tracing. So if, for instance, you had it, we would then start talking with you about where you've been and who you've seen. Have you been on an airplane? Have you been, who lives in your household? Who have you come in close contact with, less than 6 feet, for more than 10 minutes over the last week or two? Because that's how we're going to try to figure out who we need to start contacting as far as they may potentially have contracted the virus as well. So this contact tracing is a very important epidemiological tool that we have to try to work back in time to figure out who somebody with this disease, this virus, may have come into contact to, so we can thus contact them and be prepared for them to also become ill. Finally, isolation and quarantine. So if a presumptive positive is confirmed by the CDC and you in fact have the COVID-19 virus, then the local health director will issue you an isolation and quarantine order. This is a legal document that is enforceable through the court systems, to where you are specifically quarantined, typically to your residence, and for a period of time to where you get over the symptoms and you have 2 negative tests confirming that you are no longer infected. The contacts, your close family, or if you've been around coworkers for an amount of time or on a plane, we do that contact tracing. If we find there are people that meet the criteria and they have been tested, then typically they would be quarantined with you. So you might see families getting to get to know each other quite well. But while anybody's in quarantine, we have a lot of mechanisms in place to support them. They will be in close contact with healthcare providers, nurses, doctors, and physicians that will be routinely checking in. How are your symptoms? Are they getting better? Are they getting worse? Are you presenting new symptoms? So that we can stay on top of their medical condition. In addition, a health department liaison will be contacting them regularly to see what their needs are. Some people, they maybe have extended family that can bring them food and medicine and supplies. For those that do not, we will be working with emergency management, with other community partners such as churches and other social organizations, and health department staff to make sure they receive what they need to survive through in the day. Food, medical needs, especially medicines if they are on those, and any other type of supplies, hygienic products, clothes, things of that nature. I believe I also noted that it takes 2 negative tests. So when a test is sent off, it takes approximately 36 to 48 hours. So it can take a while to get those 2 positives and 2 negatives, and it's important that anybody in that process remains isolated and quarantined from other people, and that is how we're going to stop the spread of this disease, is to slow its ability to infect new hosts. Reiterate, we're working throughout all of our 3 counties with all our partners, commissioners, emergency management, law enforcement, other organizations, to try to get on top of this as best we can. The second sheet I gave you is just some general information regarding how it's transmitted, what you can do to protect yourself, what are the signs and symptoms. It is critical from a public health standpoint that we get the correct information out to the public consistently and continually. And this is where this board and other organizations can work with public health and local providers to get the right information out. Facebook, as we all know, started a little scare last week. This is where we can step up, and you hear this in the community, and say, well, I was at the state website, or I was on the app healthcare website, or we just had a presentation, and here is where we really are. Getting that information out is going to be critical, and I'm open for any questions you gentlemen may have.
Go ahead, Larry. Is it possible that you could force or require the hospital to expand and open more rooms? Need?
I am not aware of, that is definitely a legal question. Then you also run into the capability of any medical facility to open rooms and have them properly equipped to receive a patient as I'm sure the hospital can tell you, will be a tall order. Ventilators are in short supply.
So staffing.
Yep, and staffing. So there are a lot of, things that can and can't be done effectively at this point.
One question for Ricky. Are the 6 beds separate rooms, or are some of them 2 to a room, all separate? So you could quarantine somebody if you had to. Okay. Then for Andy, the person that may have the COVID-19 did a lot of traveling. And more than likely, I don't know the the travel history, but that person more than likely got it traveling. We don't know, do we know where they traveled from or?
The case in Watauga was travel acquired. We do know that.
At one time, Appalachian had quite a few students that were overseas, several in China, but they've all shown no signs.
I'm not aware of that information. We have a number of persons under investigation, PUI. We have been instructed by the state that we don't discuss those individual cases because we don't want to give out false information. We don't want to stir up fear that is unnecessary. And most importantly, we have to protect that patient's rights to privacy.
And now with the health department having to focus on the virus, some of your other programs sort of get pushed to the side a little bit because of
Yes, sir.
staffing.
Yes, sir. So our clinic staff are now completely focused on our response, and that would be primarily for the triage and the surveillance. We have pulled in other staff for our community health resources and staff to help man the phones, get information out. Environmental health staff, right now, we've got a couple key, myself and Monica McKinney have kind of stepped up into the ICS. We have designated other staff to try to keep our environmental services going as long as we can, primarily food sanitation inspections, which also encares our residential care facilities, child care facilities, our public schools, and then water protection, which is permitting of septic and wells. We're doing all we can to keep our core programs going because they are every bit as important to public health as a response to a communicable disease outbreak. But as this develops and as I'm afraid it will get bigger, we will have to pull our staff more and more into this COVID-19 response, which will put other programs from community health to environmental health and dental on the back burner.
I think that one of the things that the health department does, a lot of people are trained in other fields. I mean, your specialty is one water, sewer, septics, but you're also trained to be able to help in situations like this.
That is correct. A lot of our staff are cross-trained. Environmental staff hold different authorizations. So, for instance, I'm authorized in wells, septics, tattoos, swimming pools, food and lodging institution inspections. So a lot of our staff have at least 2 to 3 authorizations. We can pull them within environmental health. And as far as the district goes, this is another point to be made is that as a 3-county district, environmental staff and all our staff work in all 3 counties. So I'm an authorized agent of the state, as is my field staff. I can pull them to what other county as needed for whatever reason. And we've been doing that effectively since I've been supervisor in 2007, so that if we've got an uptick in Alleghany County in septic permits, I can bring staff over during the week or overtime to meet those needs, vice versa. So, yes, our entire health department is you wear many hats, and now we're getting to put them all on.
One thing, when you send somebody to test somebody for the virus, it's not one person goes, the way I understand it. Is it 2 people that go?
So what the...
Work through that process, how they have to check off, one person's doing the test, another person is checking.
Yes, sir.
To be sure everything is done in a certain order.
Right. So right now, as far as if you're going to get tested by the health department, our first goal is to get you to come to our facility. We have an area in the parking lot that's been set up with emergency management in Watauga that is under a canopy tent to where we have a controlled environment as well as we can with the rain primarily. We want to keep anybody that's potentially infected outside of the building. We do not want to get that in to where our staff are and where any other members of the public that may be taking advantage of programs that we can still provide. So when we arrange for them to come to our facility at a given time. It's just, it's not like our rabies clinic where you drive up with all your dogs and you wait your turn. We have appointment times. So then when you arrive, 2 of our staff, one nurse, our 3-county health department has 9 nurses for all 3 counties. So they're working real hard. So 1 nurse is there to administer the test. Now, they are completely donned in the suits that you see, and the N95 respirators, and the goggles, and a face shield, double gloves. They are suited up to become up close and personal with somebody that potentially has this, because the test is administered nasally, and you can also do it down into your mouth and throat, which can elicit a pretty nice cough. So they are suited up and as well protected as they can be for being right next to this potentially infected person. We have a second staff that currently we are using environmental health staff. They do not have to be suited up. They can be as far away as I am to Michael and Drew to watch them administer the test and make sure that they have they have donned their protective equipment properly, follow a check sheet, and then as they administer the test, which only takes a couple seconds, you're talking a couple swabs, and then that person is gone. But then they have to doff, they have to take it all off in a systematic way so that they are not potentially infecting themselves. So the second staff is there to basically go over the check sheet one at a time. The nurses are well versed in this. They've done it a million times, but that safety factor, is in place because it takes one misstep, one thinking about something else, and we could lose one of those 9 nurses, and we can't afford that. So that would be probably the standard protocol at most facilities that you would see.
Thank you. Sir, I wanted to ask you about, you mentioned the people that's positive and they're at home, and you all are going back and forth. Do the doctors actually go out to the house if that's needed to check on that patient and
Right.
go in, or?
Well, if so, as the patient is receiving their medical monitoring, they've got a nurse or a doctor that's checking in. If their conditions change, then that physician, that nurse makes a judgment call. It may be that they need to get EMS out there and get them to the hospital because now they're in full respiratory, that they need that kind of care. It may be that they just need a checkup, but that would be assessed, and then yes, the patients would probably be seen at their facility with the healthcare providers being in full protective gear, limit their, being protected as well.
Does each county have this outside facility set up at their health department, or explain that a little bit?
So we are currently active with Watauga Emergency Management, and we created this ICS with them. They came and set that up for us. So as the need progresses, we've already been in contact with Daniel, and I'm sure those are ongoing with our ICS coordinator, Jennifer Tayson. And if it becomes necessary, then we would look at partnering with the county and your emergency management to get those assets and get them in place and then get it up and running.
I am assuming, and we know what that does, but I am assuming that you go ICS once you have a positive case.
We went ICS last Wednesday. It was when we started gearing up for it. We had several people under investigation. We could not, as you said, just assume that they would be fine. So we geared up last Wednesday and have been in preparation for yesterday's.
It wasn't spontaneous. You had valid reason to,
Yes, sir.
to start that protocol.
That is
Thank you.
correct.
Other questions?
Just one little question I hate
Sir.
to ask. How is this going to affect your overall budget? Because you're having to suspend some services that you make money on, that you collect revenue.
Right. So
Plus, you're going to need more material, I would assume.
Right. So a lot of the materials that we need for the response, Watauga County Emergency Management is actually going to 2 off-site facilities to get a lot of the personal protective gear that we need, our PPEs, and get those up to us through the ICS system. So a lot of these costs in that regard are not going to come directly to us. Now, we are having to divert staff. We're having to work a lot of overtime. I was at the state lab in Raleigh yesterday morning at 8 a.m. to get test kits, bring them all the way back, because we didn't feel we could wait until Monday for the state courier system to take that. So there is a lot of staff time and money that will, have to be used for overtime, buying additional supplies that, a lot of those we can hopefully get reimbursed through the federal government and the state. But yes, it will take time and money out of our budget and our staff's.
Mr. Chairman, I believe we can anticipate, based on the action of Congress over the weekend with the money that was allocated, that those funds will start flowing in also.
We have in our ICS system, we have a finance department, and that's what they're already on. Our staff are tracking all their time and activities and any type of supplies that directly cost the Appalachian District. And so we will be tracking those, monitoring them, and yes, sir, we will be making requests for reimbursement as we can get it.
I guess my big question is, do you feel we have adequate supplies of test kits?
Well, the test kits, as we've all heard on the national news, were a little slow in coming. And part of the problem is this is a new virus. We've not run into this family member of the COVID family yet. So it has to be developed. And then you have to gear up to have those numbers. What we respond to, this could have been an Ebola outbreak. Totally different testing needs for that. I do believe that with recent actions at the federal level to get more private companies producing the tests and getting them to market, we are getting them in more quantity. The way we are currently set up is that as we need them, we get more. They're just not going to send 2,000 to Alleghany County unless we need 2,000. And that is, to kind of the opposite of the toilet paper run is we want to manage this as needed. But as we use them, we will get more.
Supply is there.
We've been told that as we need them, they will continue to send them. But they need to keep their assets to, it's ever changing. You don't want to send us a bunch and then they actually need to go down to Halifax County at the coast. So it's more of a logistics.
Any other questions?
Thank you very much.
Thank you.
One more thing, one more question.
Yes, sir.
Would it be possible to get you back once a month for an update?
You let me know, and I'll be happy to do whatever you would request.
It'd be good,
Yes.
I believe, the current time, we work our way through this thing to have that
Sir,
coming from you guys, and
we'd be happy to. We're here. We may not be a county agency, but we are your health department.
Right.
I'm a citizen of this county. These are my neighbors, and anything I can do to help keep them safe, you just say the word, and we're here.
certainly sounds like your group is on top of this thing. We
Doing the
appreciate
best we
you.
can.
We appreciate you coming.
Thank you. Appreciate your time.
Let's see. Okay, we move on to general business. Josh Green, Public Works Director.
Thank you, Josh.
Morning. I put out a couple of weeks ago taking bids for the HVAC at the new senior center. I only received one bid in the timely manner for the sealed bid opening. The paper I just handed you was a bid that I just received this past Friday. I don't like approving bids whenever we only have one bid in there, and so I got the other one. I just wanted to show you. If you flip it over on the back, you can see his total estimate cost. I know that in that packet, I was rushed around this morning and didn't get all the pieces of paper, but they're the bid I just handed you is also bid to specs by the plans. So they're both by the plans. So I'm here this morning asking for approval for the one that we did receive, now that we know that they were within reason of the pricing.
Well, they are compatible.
Or they're identical. The email that I received for the one that I just passed out to you was, he's got it broke out for each unit, but at the end of each one of those, it says that down at the bottom, the total job cost is, and they're all the same on each individual breakdown.
The first bids you got in from Billings, have they done work for you before?
They're actually the company that did the 20 unit change out up on the BDC.
And you know their history, and they're still the lowest bid.
They are. And I want to make mention also, time's kind of a crunch, and the sheetrock guys are coming at the end of this week to start hanging the sheetrock in that facility. So my guys we're getting the rough end of the HVAC taken care of as we speak. We started it Friday. We're going to try to finish it up before Wednesday, before the sheetrock is actually delivered. So I actually reach out to Billings and ask him, if I can show you that what I've spent through the company we order all our stuff through, he's going to work with us and take it off of this number, so it's not we're going to sit here and get double billed for materials, because that's in our time. And then he said, for rough end installation, you're looking at 3 to 4 days with his crew, so he would look at the labor issue of that, and it would come off of this number here. So I just want to tell you everything that I know so far.
You have a recommendation?
In all honesty, we kind of need to take the one that was here in time for the sealed bid opening. I just wanted to show you this other one to show you that he wasn't out of line.
Do we need a
We
motion?
need a-
Motion
we
to
need a
approve
motion
lowest
to
bid,
approve.
Mr. Chairman.
We have a motion to approve
I'll second.
Billings. Have a second. No discussion. All in favor, raise your right hand. Motion carries.
Thank you.
Thank you.
One question for Josh before he leaves. I think we touched on it a little bit the last meeting. What's going to go on at the community center, the Council on Aging? Have we gotten, I know that you're working some at the new Council on Aging. When are you going to be ready to start at the second courthouse?
It's basically going to be get them moved out from there into their new facility before we can do much. Now, we did go ahead and change out a system there, the oil furnace system, which would be changed to a heat pump system for the renovation part. That had to be done because it was an emergency situation. I can't give you a definite timeline just yet, but everything's starting to fall into place when this sheetrock gets hung. We're getting to the point then where we're looking at paint and floor covering. So,
We have a set of blueprints, what's going to happen?
if you remember back whenever you and I and Mark and some of us met and we all went around with Judge Byrd, we all agreed upon kind of the layout of that main floor level there. And that was the last conversation I've really had. I do have that on a 8x14 piece of paper, kind of a rough blueprint type deal. But, it's, I heard you was telling her at the other meeting. I'll let you explain that just a little. I haven't had any conversation about anything going upstairs. I'll just leave it at that.
Mark and I were in a meeting. Taylor's lady from the state who was there. Their buildings. To the sheriff. Back from her. A suggestion.
Does that fit within our budget that we've set aside for the courthouse, second courthouse?
Any plans?
At some point, I think that the board ought to be made aware, especially with going through the budget process right now, as to when and what and how much.
I can get the 8x14 sheet for the next meeting, just so everybody can be on the same page with, you know, what the floor plan, the original talk was in the first meeting I was involved with Judge Byrd and all of them, and that way everybody can be on the same page. And, you know, that if we get to talking about putting much upstairs in that building, I don't know, as old as that building is, I don't think that they're going to be able to house the amount of people that they want to house on the upper floor of that building if the courtroom was to go upstairs. So to answer your question, I don't think the budget's prepared for that. I can't answer that fully, but I don't believe it is, because all the numbers were put together as in everything was going to be on the main floor of that building.
Can we have for Mr. Carter, can we have a report by mid-April of what the projections are?
Together what we've got. Personally, I don't know a whole lot about it other than the comments, but we'll work to put something together to present to you.
I would just propose that put that on the agenda for at least mid-April. That gives us a month to try to pull some numbers together.
Do you have a rough finish date on the, just a ballparker? Not trying to put you on the spot, just something.
Say June 1st.
Yeah. Further questions?
Thanks, Josh.
Next is Megan Edwards, Recreation Director.
Morning.
Morning.
First off, we're gonna do the mowing bids, and we got 2 back for our bid opening. One was from Bourne's Lawn Care, and the other was from Lyle's Lawn Care. The sheets we have are kind of confusing because one person did it on a weekly basis, and Lyle did his total, so I've got the numbers here. Total for Lyle's Lawn Care for how they were broken up into all 5 sections on the bid sheet was $31,500. And for Bourne's Lawn Care, the total was $40,980. So Lyle's Lawn Care was the lesser of the 2 by $9,480. So on Lyle's bid sheet, kind of broken up, the 2 main expenses were all of the administration building and all the county buildings that have been mowed every year, and he did it last year. So that total was $15,500. And the main thing we were concerned about was the fairgrounds, which ended up being $7,800, which that's 31 weeks of mowing, and it would be mowed every week. Some additional things we had them bid were Davis Field, which was $1,500. Duncan Rec and Lions Club was put together, and that one was $3,100. And then the Veterans Park was $3,600. So Veterans Park is still currently being mowed on a volunteer basis by Mr. Steve Stolt, which is fantastic, and he deserves some appreciation and just recognition for doing that. So that could be eliminated from the bid at this time. And Davis Field, the school is mowing while they're using, and we'll still have some part-time help that we could take care of that as well. So if we took the 2 out, it would be $26,400 without Davis Field and Veterans Park to do all of our normal county office buildings, Duncan Rec, Lions Club, and the fairgrounds, which also includes the fire training facility.
That's weed eating and
Weed
mulching
eating,
wherever they
mulching,
have to.
weeds, blowing clippings off, the whole 9 yards.
What's the feeling of the board, you?
Well, the gentleman that is volunteering, is he going to continue to volunteer?
As far as we know.
What do we do if suddenly he's incapacitated due to the COVID-19?
We have, that's why we had them bid it out. In the event that we were to lose that time, we can kind of divide that number by the 31 weeks and see how many weeks left we have in the season, and you have that price, or we will still have the part-time help available. That would be something that we could take care of.
Right. Nothing else, John and I can go mow it.
I can go mow it. We'll figure it out.
No problem, no problem.
Sir,
Ask a question. Megan, you might want to tell them about what you've already got planned in your budget for the upcoming year.
I put $30,000 in the mowing in contract for the upcoming year, and I also did it in the part-time help, and I was going to alleviate around $15,000 from one or the other, depending on what we chose to do. If we were just doing the administration building, then that would be the $15,500. So the main thing was the fairgrounds. I know that we knew that that was going to be a big expense. That's something that kind of gets put on the back burner if we're busy in our office. And so mowing it on a weekly basis, I didn't know how important that is to the board for that cost. But I will eliminate either money from my part-time line item or contracted line item, depending on what we decide today.
Chairman, I'd recommend that we remove Davis Field and the Veterans Park and accept the lowest bid at that, with those removals.
let me throw something out here. We're in uncharted territories for this COVID virus deal. We don't have nothing, I mean, we're just saying, if we don't have nothing going on at the fairgrounds, we could probably get by with mowing every 10 days or 2 weeks. If there's nothing going on.
That's another question I had. I mean, we have a auction coming up. With the mandate of 50 people or less, we're going to have to start canceling some events if we're going by the governor's recommendations. So that's another thing that.
We're still gonna have to take care of our facilities.
Yes, absolutely.
So I would second the motion. My concern is if the gentleman can't keep mowing, we'll have to come back and revisit that at that time.
If Bill and I are unable to do the mowing ourselves.
You got a motion?
McCall.
I'm worried about the mulch cost. To me.
And Eddie Bourne he took out the mulch and did it separately. I do not have that information from Lyle, how much he was costing for the mulch. I know that the cost of the mulch for the fairgrounds from Bourne's Construction and Lawn Care was $3,075.
Don't we have mulch at the transfer station? Are we buying mulch whenever we're trying to sell it?
Just loading it out over our Saturday.
It's good enough for me. I don't know why it's not good enough.
It's good enough for
I
me.
used it at my house too, so.
Do we have mulch all the time? Or is it just whenever they grind?
You don't put it out all the time.
We have plenty of mulch. That's something that we could work with both contractors and say and use. Now, this building, in the past, they had put the red on it. That's just gonna be, do we wanna use it? Does it matter? And in the contract that Megan found from the previous year, whenever Lyle was doing it, there was some specifications in there of what the mulch, what the standards were of each mulch bed, spraying it weekly, fluffing it, or adding to, whichever one it may be. So, that's totally be the decision of the board. If you want to use the mulch from the dump, it's there. Is it as good as what you buy? Probably not as good, but it's not that bad either. So,
Not treated.
it's not treated.
Not treated for insects or anything.
Since we're not in the red, I don't know why we'd have to use red mulch.
That's true.
What we have, to me, is full of weeds, so I don't know that we.
So we have a motion and a second. To go.
Motion is on.
To accept the motion was to
Except the Lyles, less
Take
the
out
Veterans
Davis Field.
Park and Davis Field.
His cost was $26,400 for those facilities, and just for comparison, Bourne's Lawn Care for those facilities was $29,665. So there was a $3,265 difference.
Any further discussion?
So do you all want me to check with Mr. Lyle on what the cost would be without mulch?
There's
We're-
still gonna be mulch that he'd have to pick up and spread and.
To see if there's a difference on what we're using and if we're using the mulch.
That'd be my preference.
Okay.
We want to back up and table this till next
I
week
withdraw my motion, sir.
till we find out.
We are not going to be able to start the contract on 1 April if we do that.
The grass is gonna be,
We're gonna take that off. We're gonna table that till,
Motion to table until the the first April
right.
meeting.
Motion and second, any discussion? All in favor, raise your right hand. Check that out and we'll be ready.
Okay.
1st April.
And my second thing I have, I received an invoice from Aquatics H2O for the sealed engineer plans that we had drawn up for the slides at Duncan Recreation. I have looked back through some emails, and the first contact with them with the price was August 14th. They had, previous director had been in contact with this company since June. So all of this stuff was done way before now, but the invoice date was November, and I reached out to the company and told them that I wasn't comfortable paying the invoice until I had seen the plans, because I hadn't actually seen them with my own eyes. So I do have those now, and the invoice has to be paid for $2,030, but I had checked with Drew and with Karen just to make sure that we didn't have a request to pay this previously, and it had not been requested, so I'm just here to request $2,030 out of the Beamer fund to pay for the pool slide plans the health department has received.
Open for a motion or discussion.
Motion to approve.
second.
Motion and second, any discussion? Everybody raise your right hand. Motion carries.
Thank you.
Thank you. Next is Alleghany Fire District Resolution.
Motion to approve.
A motion to approve. You need to read all this.
We do. It's available to the public.
Motion to approve. Do I hear a second?
I'll second. We beat it to death.
Yep. Motion and a second. Any discussion? All in favor, raise your right hand. Motion carries. Alleghany Fire District Resolution Rate Limitation.
Motion to approve, sir.
A motion to approve. We have a second. The rate limitation was the 15, the cap on the.
Need a second.
I'll second that. Motion and a second. Any discussion? All in favor, raise your right hand. Motion carries. Do the, that on right. Goodness.
Got another.
No. Does that take action or no action? Yeah. Need to do that here. Okay, there you go. Triple hand.
Morning.
Thank you.
We will have to make some decisions about our health insurance, employee health insurance, and the benefits we provide to employees this morning as it relates to the COVID-19 virus. Blue Cross actually sent out an email on Friday asking for an opt-in or an opt-out to waive member cost sharing requirements, including deductibles and copays related to the diagnostic test that are medically necessary, ordered by a physician, and consistent with the CDC guidance related to the COVID-19 virus. This will also waive prior authorization for covered services of the COVID-19 also. So basically, we need to decide to opt in to waive these fees, or we can opt out. It is Blue Cross recommendation that we do opt in. And we do have, after 30 days, we can revoke the opt-in if we so desire.
What's your recommendation?
My recommendation is to opt in. Then after the 30 days, say we have about 152 people that are actually on our insurance. That includes employees and dependents. If everyone needed a test, you're talking about $6,000 basically with copays. The higher of the copays, the $40, if it's, if we had through health department, it's going to be a $20 copay, so it would be less than that. But as we just heard, it could take up to 4 tests if somebody does test positive. There would be 2 positive and 2 negatives to confirm. So we could be talking about $24,000 if everyone went for a test.
Mr. Chairman,
Discussion.
listening to the news, as I understand it, the federal government has passed legislation where they are going to pay for the test, but in all due caution, I would recommend that we opt in on this, just as a safety measure, mainly because, granted, if someone tests positive and then they have to have 2 negative tests, they may have a positive test, which would require 2 more. So we are now multiplying the possibilities. So, especially in this case, and since I'm in a danger group, I highly recommend that we get it.
And just to clarify, it does cover the treatment also. So if we have someone that, ended up hospitalized, it is going to cover the copays for those treatments also.
Have a motion to opt in.
Yes, I will make that motion, Mr. Chairman.
Have a motion. Do I hear a second?
Second.
Motion and a second. Any further discussion? All in favor, raise your right hand. Motion carries.
Thank you.
Alleghany in motion. Does that require a vote?
Yes.
Alleghany in motion.
I can address
Okay, go ahead.
it. In conversation with Tiffany on Friday and today, really loud, we talked about the transportation here in the county. And as you all know, we provide not only in-county transport, but they also do out-of-county transport. What we discussed this morning was to temporarily suspend all airport transportation as a starting point. Additionally, to temporarily suspend what's called non-essential. Basically, we want to provide only medically necessary trips, and we want to limit the in-town transportation for the safety of both the drivers and the passengers. And I'd like to make that effective immediately. In a related manner, we also talked amongst a couple others about temporarily suspending all non-essential work-related travel outside the county, which I think that's kind of taken care of itself because a lot of these conferences or these opportunities are canceling themselves. But as an added precaution, we'd like to temporarily suspend those as well.
Heard the request for the Alleghany motion be suspended several trips from the airport, non-essential.
question.
Okay.
How do they, when somebody uses the vans, do they go in and clean them? What's the process for keeping them clean? Is it after every trip? Do they wash the handrails, the seats, the windows? What do they do?
They go in and disinfect the vehicle after each trip, as I understand it. So they have been doing that now for some time. They did have an airport transportation that was scheduled for today, but I got an email that basically said that had been canceled also. But they are taking safety precautions at each trip.
I assume we're doing the same thing in this building, washing, the bathrooms, the
Scheduled
fixtures.
and as needed. Yes, sir.
Any more questions? Hear a motion to accept.
So moved.
Second.
Motion and a second. Any further discussion? All in favor, raise your right hand. Motion carries. Order. Next up, general business, no action taken, will be the Veterans Park brick sale.
And I can talk briefly about it. I think each commissioner received an email from some time ago, and Commissioner Bobby Irwin, you can fill in the blanks where I fall. But it's my understanding that there was some discussion some time ago about the ability to order specific bricks for those provided their service. I think that has ran into an issue that has since suspended the ability to have a vendor produce those bricks. It was asked if there was a mechanism that the county and or the Veterans Committee could take to be proactive in trying to provide support in bringing that back to life. I also sent that information to Ms. Shoemate. I don't know if you have any comments on it as well. But
It just appeared that one of the letters from the Department of Defense said that if you had a licensing agreement between the brick producer and DOD, that it could proceed. So I think that the steps that need to be taken is to find a vendor that has the licensing agreement, or to use the current vendor and ask them to procure that license before they can proceed with the production.
I'm not certain if the board would like to direct a certain path, but if so, we'll certainly pursue it. But it was an item that was requested.
Just don't see how this fits in the county business.
Tend to agree with that. I think this is a veterans FW.
It's actually the copyright laws, Mr. Chairman. I've dealt with this with the Marine Corps League on a statewide basis and also with other detachments, and what has happened, the services have taken control of their insignias. Prior to certain events of probably 10 or 11 years ago, the services had not copyrighted their insignias. And the Marine Corps became aware of some things that were going on. The quality of the products were not what you would expect for the Marine Corps, and whenever they went to the manufacturers advised the Marine Corps that they could go pound sand because they had never protected their insignia by copyright, and they had absolutely no recourse, which immediately the Marine Corps started copyright procedures. Now, if you see something, it will have a Marine Corps Eagle, Globe, and Anchor on it saying that it has been approved by the Marine Corps. I know a Master Gunnery Sergeant that was in Fire and Rescue in Quantico was making canes, one of which I have. Never got approval. Slapped down pretty good and had to stop production until he did get approval. The bricks that we have now, we have a letter that is authorizing them. If we had not received that letter, what may have happened to us is what happened in Greensboro. They dug up, I understand, all their bricks and they destroyed them in front of service representatives. So we're good with everything that we've got right now. It's copyright laws of the great United States. To get around this, we'd have to change copyright laws. That's way above our pay grade. So I don't think there's anything that we can do. I would suggest that no bricks be sold until they have been assured that if they're going to use the service insignia, that the manufacturer has the proper credentials, authorization.
It's just not the Marine Corps, it's all the services
everyone.
that we got a letter from. The Polar Brick Company that makes these bricks and continues to make these bricks has not been approved as of our last correspondence with the DOD. We still make bricks and sell them to whoever's ordering them. They changed their form about a year and a half ago when we had to stop. They put a disclaimer at the bottom that says whoever's purchasing them has the trademark approval to use them. Obviously, we don't have that. The way I understand it, Polar Brick is located in Florida. We were searching for brick manufacturers. They were the best price. We went with them. They produced all the bricks that are in the ground now, and we had got a late letter that said that we could keep those bricks. Anything additional, we had to, that the manufacturer has to be approved. My last understanding from Polar Brick, they had been approved for, there are certain steps, I think it's 8 or 10, and the last step they were be approved by had a lot to do with child labor laws, stuff that was made overseas that the military didn't have any control over. Well, Polar Brick's made in Florida. They don't, that's one of the things that DOD, I guess, is, I'm going to say dragging their feet, but this has been going on for a year and a half. I know of a local cemetery that's wanting to put up plaque or a marble monument that has all the military emblems on it. Well, if you read this letter, they can't do that. Or if they do it at their own risk. I'm just, my concern is that I think that we need more help from political people to get this done. The people in Florida have at one point sent us a letter that their one of the congresswomen from Florida was helping Polar Brick to get this done. I think that we should, use some of our politicians. North Carolina has one of the biggest retirement of military people in the state, in the country. That's what I'm after. We've had umpteen people send the Veterans Committee checks wanting a brick to honor certain people. And we're holding the checks, we deposit them and holding the money in a separate account. But we can't do anything with it at this point. So I don't know what Mr. Carter's wanting the board to do. I don't know what Kenneth Vaughn was wanting the board to do. But I've talked to Virginia Fox, and she's willing to go ahead and try to do something, but I can't get whoever to release the information that we've received from Polar Brick to give to her office so they can get started.
Is there not another vendor that is licensed?
What?
Is there another vendor that is licensed?
We don't know of any vendor that is licensed. I don't know, there may be and there may not be, but I do know Polar Brick said they're still selling the bricks just like they used to. I mean, I'm leaving this up to, I guess, Mr. Carter.
Well, I'm uncomfortable with taking that stance. Here we are trying to enter into support for a company that's making a profit off the bricks. If there is another vendor out there, they've gone to the time and expense to get certification from the services on their insignia. So here we are, we're doing someone else's job. I will say this, at Quantico, at the Marine Corps Museum, you will not get a service emblem because they can't find a supplier.
Well, I know
They've stopped that, so.
It's just not bricks, it's hats, it's coats, it's shirts. Anybody that's wearing one of those is in violation if it's not made by a vendor that's been approved. But how do I know when I buy a t-shirt if that vendor has been approved? John's got a real nice looking jacket, Marine Corps stuff all over it. It's made in Vietnam. I have no way to know if they use child labor laws or if they abide by them or what.
That's correct. I have a jacket, but whenever I purchased that jacket in the PX, it had an official symbol on it authorized by the Marine Corps.
Because, I mean, anybody can make that tag.
Well, you would hope that in the
My whole
PX it
point
wouldn't be
is,
there.
I'd just like to be able to send the information to Virginia Fox and let her start doing something.
Well, the whole reason it's on the agenda today was as a result of the inquiry. It was as a result of communication with Kenneth Vaught, who is active as well. The email that Mr. Vaught provided to me, he could not be here today. I actually asked him if he could be. He could not. His thinking was that the county could form some type of decision. I told him that from a manager standpoint that wasn't something that I was comfortable in doing, that I just feel that that's not act of a manager. If that's a collective thought from the board, then so be it. But that's why it's here. I don't have a recommendation other than what Ms. Shue had said is law's the law, and that's what we've got to work within. So it's something that I don't think that I need to reach out and provide any direction on, but if the board feels that there's some type of encouraging or supporting document that you'd like to include, I'll be happy to do that.
The board can do if they want to, or they don't have to. But an individual citizen can still get a hold of Virginia Fox and provide her with whatever information the Veterans Committee has, because those are public records.
Like first steps, like Donna's recommendation, you got to find the company's got a trademark. I mean, if there's one out there.
License and agreement. It's no different than collegiate things. I mean, you can go to Walmart and buy a Carolina t-shirt, but it's going to have that same thing you're talking about. It's going to have a label on it saying it's been approved and officially licensed. The reason those bricks were cheaper is because the vendor's not paying for the official license.
I think the board would be in support of some kind of letter, recommendation, or something to send up to Washington, or to the senators and Congress. Support that, but first steps is first, I guess. You got to have a trademark.
If there's a vendor that is already licensed to produce these things, that would be the easiest route to go.
There's no action required other than just discussion. Yes, are we satisfied with where we are on this? Further discussion? Move on to the consent agenda. Board action requested. Ms. Rita Miller.
I do have some questions, Mr. Chairman.
All righty. Morning.
We have a rather large, please explain the $23,200. Property was foreclosed upon for delinquent. It shows up in release and release at multiple pages.
That was the property that the county foreclosed on over near the landfill. We didn't have a buyer for that, so it becomes the county's, and so therefore we have to, that's no longer a lien once
Okay.
the county became the
Well,
owner
you
of
got
the
to take
property.
it off the books because now we own it.
Correct.
We aren't going to pay ourselves for it.
No.
The other question that I have is your delinquent taxpayer contracts
Yes.
showing current due on a number at 0. Why are they included? If they paid it, how can they be at default?
The way our software does that, I can check with our software vendor and see that. It's just saying that it is, that particular part of the bill has been paid. They may have another bill, another year's bill that has not been paid that we've not actually coded as a
So that
payment
kicks them
agreement.
in.
Yeah.
What are you doing? Some of these people have been on here for quite a long time.
I did
Have
go.
you taken that legal action on them?
I did go through and ask Missy to look those up. So We've got 4 of those that have been sent to Cania for collection. We've got one now that has started paying. She's contacted those to see if she can get them to come up to date with their payment agreements. And if not, then we'll take whatever action we have available. If we can't do attachment and garnishment, then we'll send it on to Cania.
Mr. Chairman, that satisfies my questions, and I will make the motion that we approve the consent agenda minus Roman numeral 2, which was deleted prior.
I do have one correction on here. Also, the compensation for the license plate agency, that was overstated. Cole had written that in for me as I was at school last week, and actually it's $4,223.58, not $42,000. Make sure we made that correction.
Broke our heart.
Okay. We have a motion to accept with the exclusion of the number 2 High Country Workforce Development Board appointment, which was taken out a while ago. Do I have a second?
Second.
Motion and a second. Any further discussion? All in favor, raise your right hand. Motion carries.
There is one thing on there that I don't know if it would have been consent agenda or not, but there is one thing on there, and that's the request for approval of the late application for the forestry use, present use. So when those come in, I have to deny them because they're late. But then the board has to decide whether I can approve that. The board has to approve or deny that. In the past, the board has approved those, but it's my responsibility to deny it because it wasn't timely filed.
So we approve your actions, correct?
Approved her recommendation.
I can't make a recommendation on present use late application because I have to deny it. Then I have to bring it to the board to either say that they'll approve it or deny
Are
it.
you asking us to approve your actions? You've already taken action. Are you asking us to approve the action that you have taken?
So with the present use value, I have denied it because it wasn't timely filed. And when that happens, they have to submit a letter to you saying why it was not timely filed and ask you to either approve or deny. Historically, the board has approved most of these based on, we don't have a definition for good cause. So that's up to the board on a case-by-case basis whether to approve or deny them.
This is not on the agenda.
Is that, I don't think that's on the agenda.
We need to back up here and.
On the consent agenda,
A solid waste request for release, but you don't have a
Have a forestry request.
Not in
forestry
there.
request on there.
We've already approved the consent agenda. We can't change anything.
So we need to back up maybe in
That on the next
agenda,
Next one, okay.
1st of April. Is that work on your side? Okay,
It's fine.
okay.
table.
Table, do we need a motion to table?
It's not even on your agenda to table.
Okay.
Just
Take any action because
Can't
it's
take
not on the
no action.
agenda.
It'll come up April 1st, on the April meeting.
thank you.
We're getting pretty good on this agenda.
We've had a lot of practice lately.
Yes, we have, haven't we?
Public comment time. Anybody have any public comments they'd like to make at this time? Please come forward.
Good morning. Call for your deliberation this morning. Are you going to address any action on the state of, is that going to be?
Coming up in comments.
Okay.
Right.
And the town council, we have 2 declarations for consideration to the mayor. One would be to include the town of Sparta under the county's declaration. And if the county did not act, then I have a separate one that the mayor would act, just would be independent. But I think our preference would be if the county's going to enact one, that the town would be included. And you've got a copy. Okay, good. Thank you.
Thank you. Other comments? Seeing none, we'll move on to county manager's comment.
Couple, Mr. Chairman. You've got a building inspection report on page 36. Encourage you to look that over. There was a question that came up earlier about the courthouse plans, and Drew did her magic, and it appears that according to Nick, with the sheriff's office, that new plans should be available on March 20th. So, we'll see. And that way we can update from there. My last comment, everybody look at that board. It was left in here, but while we're talking, that board with the handwritten numbers on it, that's our budgeting process. And as of Friday, we got about $18.2 million in request, and we've been able to come up with about 17.8 of revenues. Now, certainly still premature, but that number originally was about 2.4, if I remember correctly. So that's a quick update on our budgeting process. I don't want to go into detail other than what was said, but we continue to work on that at this point.
Thank you, sir. Next is commissioner comments, and I'm going to start with the comments. We're going to do the declaration of state of emergency for Alleghany County, and I'm going to read this. Whereas the governor has issued a state of emergency for the entire state of North Carolina due to the potential impact of the COVID-19. Whereas as a result of the above described disaster, I have determined that there is an imminent threat of or existing conditions that have caused or will cause widespread or severe damage, injury, or loss of life or property. Whereas declaring a state of emergency and imposing restrictions and prohibition orders herein is necessary to maintain order and protect public health, safety, and welfare, and to secure property. Now, therefore, pursuant to the authority vested in me as chairman of the Board of Commissioners of Alleghany County under Article 1A, Chapter 166A of the North Carolina General Statute and the Civil Preparedness Ordinance of Alleghany County. Section 1 states a state of emergency is hereby declared within the jurisdiction of Alleghany County. Section 2, the emergency area covered by the state of emergency shall be the entire area of Alleghany County. Section 3 is omitted. Section 4, hereby order all Alleghany law enforcement officers and employees and all other emergency personnel subject to a control to cooperate in the enforcement and implementation of the provision of this declaration, all applicable local ordinances, state and federal law, and the Alleghany County Emergency Operations Plan. I hereby order this declaration to be distributed to the news media, other organizations calculated to bring its content to the attention of the general public, to be filed with the clerk of the Board of Commissioners, and to be distributed to others as necessary to ensure proper implementation of this declaration. This declaration shall take effect on the 16th day of March 2020 at 12 p.m. and shall remain in effect until modified and rescinded. Declared this the 15th day of March 16th, 2020. This court, I just want everybody to be vigilant and know what's going on and stay aware. With things are changing as we move forward. The health department is people you need to look at to get the final decision on things and the straight facts about things. They're updating their website. That website is apphealth, apphealth.com. It's a good place to go. Of course, the hospital folks can do the same. They're all working in conjunction. The town and the county and the Council of Aging, they're going to be helping out with the elderly. And we're all kind of not trying to scare nobody, but we're in uncharted territory, and we need to listen to what the authorities are telling us and the CDC. And it's a life-changing event for a little while for all of us. I mean, things is going to change. We've seen things in the grocery store we've never seen before, and let's all just stay vigilant and practice the safe practices. The main 5 tips for prevention, of course, is washing your hands for 20 seconds, and the elbow, no hugging and shaking hands and that stuff, and don't touch your face, and stay 6 feet away. Let's stay vigilant. You know, it's a hard habit to break. I find myself sticking that hand out, and you don't think, and if you feel sick, of course, stay at home. But I think this is a serious matter. see a lot on social media that kind of don't think so maybe, but I think we need to certainly pay attention and keep our citizens safe and check on the elderly if this thing progresses and gets worse. I mean, we're all here to help one another and do what we can do to all of us get through this. That's just what I want to reflect on after reading that declaration, and this is the first for everybody, so let's work hard at trying to get through this, get everybody up to speed and up to date. Commissioner Irvin, John.
Just to pile on to the chairman's statement, a lot of people right now are referring to the Spanish flu, what we refer to as the Spanish flu of 19 and 18, where 50 to 100 million people died of that flu. One of the things that people do not realize, and you're jumping through the hoops right now, that was an entirely different set of circumstances. That flu started in Kansas City. It started spreading into the military training bases. So President Wilson was told that he should not send those troops that had been trained to the war in Europe, and he loaded them up on troop transports, and it was like going into a petri dish. And then it spread because at the end of the war, all the troops that had been exposed by the American troops went back home, and it became a pandemic. Now we realize how it was spread. We have learned. We've already lost 40,000 lives from the regular flu, and here we are less than 100, and everybody's going out and buying toilet paper. Now, if you're going to stuff it up your nostrils and breathe through the daggone tube, it might help you with your toilet paper. I guess we now know what the American public holds most dear in a time of crisis. So it does call for caution. You're on it. Everybody's saying we should have more test kits. Well, you can't make a test kit until you know what you got to test for, and it takes time. Federal government is stepping up. They are activated. I never thought that I would see something like this. It is everybody jumping through the hoops, trying to get ahead of the game. We will. We've been through worse. Don't panic. Guard your toilet paper, and after it's all over with, whenever you start selling it on eBay, expect 10 cents on the dollar. Thank you, Mr. Chairman.
Thank you. Commissioner Prince.
Hate to follow the toilet paper discussion, but I think we're doing the right things. I think it's a good meeting. I continue to pray for our congregation, for our people, for the county, for this virus. I'm suffering from the budget flu, and I think it's been a great process. We've worked hard to try to get the numbers down, and we will continue to do so. That's all.
Mr. Bobby.
Just a quick mention that the fairgrounds cleanup, I think we had a great day last Saturday. Several volunteers showed up and did a lot of work. Now we still got a ways to go, but hopefully the weather will change one of these days and we can do more. One thing about the resolution is there a limit on the number of people that can be in a crowd? I've heard state numbers, I've heard local numbers.
The number is 50.
What are those numbers?
50. That came out yesterday from the CDC.
Does that apply to our factories that are here in town? Is that just general public? How does the 50 work?
I don't know.
We have our emergency manager in the rear, Mr. Chairman, who could answer that.
You need to see it on the television.
In the state declaration that came from the governor's office, the number is actually 100. I've been hearing 50 tossed around a lot, but it's actually 100. At any rate, from what I gather, normal operations are exempted from that requirement. So if you have a factory that employs 200 people every day, that's a normal operation, so that's exempt. It's a special gathering that they're trying to halt on.
The number's 100.
That's right.
I had seen on CDC yesterday where I got that 50 from, you know.
Now, the CDC probably has their own guidance, but Governor Cooper's order was for 100.
We go
We're
by
going-
the
we're
state
going-
guide.
That's right. The CDC is just a guide, it's a guideline, it's not a requirement.
Recommendation.
You have anything else you want to add?
Yes, sir.
Ms. Doty, from the hospital, do you have anything you want to comment or say, or don't want to put you on the spot? Just wanted to offer.
We're prepared. We're prepared. Set up and we're.
Thank you.
I believe our local news media has a question. No? Oh, Miss Shoemate, her honor. Congratulations.
Thank you.
Very much so. We hate to have to make a decision here for too long for a placement, I guess.
Would like the public to know that whenever she came into the room, we did stand, and she forgot to tell us that we could sit.
Told him I didn't have a bailiff yet.
Did we miss the public comment?
We have a fire meeting tonight.
Did I do that? Okay. Short memory.
Senior moment.
Senior
Brian
moment.
spoke.
Okay. There is a fire meeting tonight in Sparta Fire District. I'd encourage the Sparta residents or anybody else who wants to come out and share in that and find out what's happening in the fire tax. Yes, sir.
What time is that?
7 o'clock. Sparta Firehouse. Anybody got anything else? Mr. Carter, Drew, Donna? Entertain a motion. Thank you folks for coming. Entertain a motion to go home. Motion a second. All in favor? Thank you everybody for coming out today.